set of slides are called Breathe, and this is all about helping anxiety in our patients right now. So the first set of patients are our COVID-19 positive patients who are on the ICU or invasively ventilated. The first thing to remember is that we need to manage our relatives' distress and their expectations while the patient is sedated. What relatives need is contact and information. The second thing to think about is that when we desedate our patients, it's really common for them to be disorientated and confused. In our ICU patients, that often lasts until the sleep-wake cycle returns, and that's usually on the ward. To help these patients, try to orientate them. Try to tell them what's going on around them. Offer them as much reassurance as possible, and where you can, get their sleep-wake cycle back to normal. The second group of patients are our ward-based COVID patients. What we know so far from these patients is that they're very, very aware of shortness of breath. And of course, in these challenging times, they're isolated from their loved ones, and they're scared. And they're surrounded by people in PPE, which must be quite strange for them. So a lot of them we know will be experiencing anxiety around breathlessness. To help them, it's really important to acknowledge that this feels scary for them, but it's okay, you're here to help. Try moving the patient's position to open up the lungs, to sitting more upright or having more pillows if lying down. Here's some breathing control techniques. Patients fight to get air in, and they overbreathe and they suck air in. Try to ask them to take a big breath out to empty their lungs, like a big sigh. If you're starting to get the patient up and about, ask the patient to breathe in through their nose and use it with pursed lips breathing. So they blow as they go, breathing in through the nose and blowing out through the mouth. Try to slow the patient's breathing down to a steady pace. You can do this using counting. So it's in, 2, 3, out, 2, 3. Or you might ask your patient to pace their breath following a square. So breathing in, corner to corner. Breathing out, corner to corner. In, corner to corner. Out, corner to corner. So find a square somewhere on the ward. For patients on CPAP, often they get into a bit of a fight with the machine where they struggle to trust the machine to support their breathing. If you can, encourage them to go with the machine, and a useful phrase to use is let the breath breathe itself, and remind them and reassure them that the machine will support them. There are a group of patients who are in our hospital who do not have COVID-19 but are still very anxious anyway. It's important to think about how we approach those patients. If we stay calm ourselves, then they feel like we're a safe pair of hands. Listen to what they have to say. Hear and acknowledge their feelings. Where you can, normalise their feelings. Many people are scared right now, and it's really okay to not be okay. And that slow breathing technique, it works for them as well. So if they're getting into a panic, maybe just before a procedure, try that slow breathing with them. So breathing in, 2, 3, out, 2, 3, all following the square technique.